Hello, my name is Tiaja. I am an RN. This is a presentation that I have made for BCIT's NSPN 7155 breastfeeding course. Infant with physiological jaundice and a mother with flat nipples, we are going to create a care plan using a situated clinical decision-making framework. So our scenario is baby Jonathan was delivered at 37 weeks gestation. He's 3 days old and he's at home with mom. You are a healthy beginnings nurse and you're doing their very first home visit checkup. Bethany greets you at the door. Baby Jonathan is crying. Beth tells you that Jonathan hasn't eaten in a few hours. Bethany's flat nipples are sore and they don't seem to let down any milk. Bethany says in frustration, "My grandmother was right. I cannot breastfeed with flat nipples. I will have to feed Jonathan formula." You look at baby Jonathan. He's fussing with hunger and you notice that his skin and sclera are tinged yellow. There will be a quiz at the end of this presentation, so pay attention. There are 5 components of the situated clinical decision-making framework: knowledge, cues, judgment, decisions, and an evaluation. 3 key points to keep in mind throughout this presentation are overcoming the breastfeeding challenge of flat nipples, ensuring the infant receives adequate hydration and nutrition from a mother with flat nipples, monitoring an infant's jaundice and knowing when more acute interventions are needed. So for the knowledge portion, we're going to learn about the anatomy of the breast, physiology of breastfeeding, and pathophysiology of jaundice. A quote by Shakespeare. To the right, you see an image of a lactating breast. During pregnancy, a woman's breast changes to be able to produce milk, and this milk consists of fat, protein, carbs, vitamins, and minerals. This is all the baby needs for 6 months. You will see 2 images, one of a normal nipple. Please note that the nipple extends past the areola, in contrast to the flat nipple, which is pretty flat with the areola. Nipple pain is one of the most common reasons why mothers stop breastfeeding their baby. Flat nipples and incorrect latch can cause discomfort, both physically and emotionally for the mom. Mothers who are supported and helped to correct painful breastfeeding in the first week have a better long-term breastfeeding results than mothers who wait longer to seek help. And improving the latch helps reduce pain in 65% of cases. In many cases, infants and mothers can learn to latch effectively with flat nipples. Typically, the infant suckling can draw out the nipple enough for effective milk letdown. It is important to ensure that the infant is latching onto the areola, not just the nipple. You could also use nipple shields, but these are for short-term use only. Sometimes they can lessen the milk flow or cause clogged milk ducts and mastitis, and it is extremely difficult to wean the baby from the nipple shield back to just the regular breast. There's also Hoffman's technique, which is a physical manipulation of the nipple, and this was believed to help loosen the tissues and free the nipple. Both of these alternatives aren't typically recommended by healthcare providers. Shakespeare. What is jaundice? Jaundice is the yellow coloring of the tissues, most commonly noted in the sclera of the eyes, the white part, and the skin. Happens in up to 60% of newborns. And jaundice is caused by a buildup of bilirubin, which is the byproduct of the breakdown of red blood cells. Normally, these byproducts are broken down in the liver and they are excreted from the body in the stool and urine. Jaundice happens when there's just too much bilirubin byproduct in the body. There's 2 types of jaundice: pathological jaundice, which occurs when there's liver damage or blood incompatibilities in the baby, and physiological jaundice, which occurs due to physiological changes that happen between life from the womb into the world. So newborns are more susceptible to hyperbilirubemia than adults for 3 reasons. Neonates are born with a higher concentration of red blood cells, and this is to help facilitate oxygen flow in the hypoxic condition of the womb. Neonate livers don't always work so great right after they're born, and the newborn diet, which we'll talk about more in a second. So there is a form of physiological jaundice often referred to as not enough breast milk jaundice. And this isn't due to a problem with the mother's milk, it's simply due to the baby not getting enough of that milk. It's typically noted 1 to 3 days after birth, and typically resolves with frequent breastfeeding. Sometimes the mom and the baby have difficulty getting a latch, and then the infant doesn't get enough milk and then becomes dehydrated. This makes the digestive system slow down and brings opportunity for bilirubin to be reabsorbed into the body. In some cases, hyperbilirubemia causes the baby to become lethargic and simply won't eat, which just exacerbates the problem. Also note that breastfed infants are more likely than formula-fed infants to get jaundice. So jaundice is diagnosed many ways. You could use a transcutaneous bilirubinometer, which is an instrument which non-invasively tests the coloring of the tissue. You could do blood work. You could also do a simple head-to-toe assessment. Check the color of the baby. Jaundice is typically noted in the face and then the trunk, and then last will present itself in the limbs. How active is the baby? Are the stool and urine output normal in color? And is there adequate amount of both of them? And is there any significant weight loss? Treatments. First of all, continue feeding your baby at least 8 to 12 times a day, and then figure out what caused the lack of breast milk fed by the infant in the first place. Problem solve with your healthcare provider on how to get your baby to feed better. There's also phototherapy, which is a bright light which can break down the bilirubin into a water-soluble byproduct, which is easily filtered and excreted. In very severe cases, you would have to do a blood exchange transfusion. So for cues, baby Jonathan is not lethargic, he's still attempting to breastfeed, and he does tolerate expressed colostrum. His bilirubin levels are only slightly above normal for his age after birth. His urine is darker than normal, but his stool is still normal. His sclera are slightly yellowed, and his forehead is slightly yellowed, but the rest of his body is normal. He hasn't experienced any significant weight loss. With mom, her nipples are flat, reddened, and sore. She's determined and she wants to breastfeed. She simply lacks the knowledge and support. And then with their feeding relationship, there's poor latching. Mom is keen on breastfeeding. She's currently uncomfortable breastfeeding due to pain. And then Jonathan gets frustrated at a lack of milk flow due to his poor latch. So what is happening? Bethany has flat nipples. She hasn't been taught how to properly latch her baby to her breast. Jonathan is not getting an adequate amount of breast milk, and Jonathan has developed a common form of physiological jaundice. Our priorities are to support Bethany and teach her how to effectively breastfeed with flat nipples, to ensure Jonathan gets adequate nutrition from the breast, and to monitor Jonathan's jaundice, and then we'll treat him for clearing the jaundice. We will consult with other healthcare providers, and it's determined that Jonathan has a very mild case of physiological jaundice and does not require acute treatments. We are going to encourage frequent breastfeeding, and then we'll teach Bethany how to pump and hand express to maintain her milk supply. Formula is not recommended. Mothers with flat nipples should be seen frequently by healthcare providers until an effective latch is maintained. We're going to teach Bethany how to latch effectively. We're also going to let her know about other resources available in the community to support her. To evaluate how our care plan has gone, we're going to get Bethany to show us a good latch with baby Jonathan. We're going to have Bethany record the length and frequency of Jonathan's breastfeedings. We're going to monitor Jonathan's urine and stool for color changes. We'll give them pamphlets about signs and symptoms of jaundice, and then tell her when and where to seek help if the situation worsens. We'll also do some frequent home visits and get her to visit her public health facility as well as her physician if she has concerns. For personal learning, I had no idea about the frequency of jaundice in newborns. I also learned about the benefits of breastfeeding an infant with jaundice. From a personal level, I'm going to be a new mom in August, and I learned about all of the amazing resources that are available in the community. Here's a little quiz. I will post this to Blackboard. my references. And thank you so much for watching. I hope you've learned something.